Respected viewers, Assalamu alaikum. This video is first one of the upcoming videos about breastfeeding. Now the breasts are medically known as mammary glands and they are exocrine glands. And the Latin word used for the breast is mamma. M-A-M-M-A. Each breast consists of 15 to 20 lobes, and this is the milk producing part of the breast. And each lobe further consists of smaller structures called lobules and tubo-alveolar glands. The darker skin area around the nipple is called areola. Areola contains several small modified sweat glands. They are called Mammary glands and they produce oil that cleans and moisturizes the nipple and areola. The nipple has several small openings through which the milk formed by the breast flows out to the baby. The female mature breast also consists of adipose tissue or fat tissue which cushions and protects the breast. It has also connective tissue and ligaments called Cooper's ligament that supports the breast. An important point to note is that the size of breast depends upon the amount of fat tissue in the breast. Now the women with larger breast have more fat tissue as compared to the woman who has smaller breasts. It means that the larger breasts has not greater amount of glandular tissue, and every woman has enough amount of glandular tissue to establish the enough milk supply to the newborn baby. It means that the size of breast does not matter. Now in the upcoming video, how the breast milk is formed, this will be discussed inshallah. Allah Hafiz.